Hello future doctors, welcome back to our channel TEDxU. Today in this video we are going to discuss an important topic, that is complicated cataract. Okay, so what is the definition? The complicated cataract is a lens opacity which is caused by another intraocular disease. So there is underlying diseases that are causing this complicated cataract. And here we should avoid using the term secondary cataract because it gives confusion with the other cataracts. Okay, so what are the causes or etiology here? The lens depends on intraocular fluid for nutrition. Okay, but if there is any disease that is interrupting this intraocular circulation or producing inflammatory toxins, that leads to the cause of complicated cataracts. Okay, so the key causes may be inflammatory conditions, degenerative conditions, retinal detachments, glaucoma, and the last one is intraocular tumors. Let us discuss one by one. Inflammatory conditions. Okay, for examples, uveitis, which is most common. The diseases comes under are iridocyclitis, pars planitis, and choroiditis. So these cause complicated cataract, and hypopyon corneal ulcers and endophthalmitis. Endophthalmitis is nothing but deep tissue involvement in inflammation. Second one, degenerative conditions. Here it will be retinitis pigmentosa or myopic chorioretinal degeneration, etc. And in retinal detachment, you will get long standing cases may cause cataract. So long standing cases of retinal detachments can cause cataract here. Next one, glaucoma. Glaucoma is there will be defect in the visual field and increase in the intraocular pressure. So raised intraocular pressure affects circulation, which leads to cataract formation. And the last one is intraocular tumors. Childhood, we will get retinoblastoma, and in late stage of melanoma you will get this complicated cataract. So these are the causes that you must remember here. Next one is clinical features. So here the clinical feature starts as posterior subscapular cataract. For example, if this is lens, the posterior subcapsular cataract, the opacity will be here. Okay, posterior side of subcapsular, and this can be seen in slit lamp examination. In the slit lamp examination, you will see breadcrumb appearance, polychromatic lusters which are like rainbow cataract, and diffuse yellow haze like yellow opacity which progresses, in which whole lens become dirty white or chalky white. And the last one is calcium depositions in last stage. So firstly there will be opacity in the posterior subscapular cataract, which in slit lamp we will see breadcrumb appearance, polychromatic lusters, yellow haze. It progresses and involves the whole lens, and last one is calcium deposits. As simple as that. Next one is drug induced cataract. Here there are some drugs like corticosteroids induced cataract, myotic induced cataract, and the last one is other drugs induced or causing cataract. First one, you will see posterior subscapular obesities which are seen in topical and systemic steroids. So due to uses of topical and systemic steroids, corticosteroid induced cataracts mostly occurs in children, and in regular slit lamp checkups we can find that. So you can prevent them by using NICs instead of steroids when possible. Next one is myotic induced cataract. In this cataract you will see anterior subscapular cataract. Anterior subscapular cataract. Long term uses of cholinesterase inhibitors. So removing the drug may stop or reverse the cataract. Third one is other drugs causing cataracts. Example, amiodarone, chlorpromazine, busulfan, gold therapy, and allopurinol. Okay, so this is the last mnemonic, that is I drip GLA2. I for inflammation, D for degenerative causes, R for retinal detachment, G for glaucoma, T for tumors, and drug induced are by corticosteroids, myotics, amiodarone, busulfan, and gold therapy. So these are the important points that you must remember regarding complicated cataract. Hope this video helpful. Consider subscribing to the channel TEDxU for more interesting videos. about MBBS topics. This is Harshita, a third year MBBS student, signing off. Thank you so much.